I'm Dr. Marcia Sonity.
And I'm Dr. Caleb Moore.
And this is
the Free Smiles Podcast.
We're back talking about clear aligners.
Hey.
That was actually nice.
Yeah,
wow.
I'm not doing that ever again. I might not edit that out. Maybe we'll just keep the bloopers for fun.
Because that was like serenading.
Yeah, anyway. Today we are discussing clear aligners for general practitioners. I am really excited about this topic because in the last year I have seen substantial growth in my office and my production in the services that I provide for patients, just by having, the resources and the knowledge to jump into clear aligners. So it's been wonderful.
Yeah, I agree. I would say, I think leaving dental school, I always thought I'll do some clear aligner cases, there'll be certain ones. Wasn't that interested in ortho coming out because I feel like we had a very interesting orthodontic program.
Interesting.
And not that it wasn't great, it was just, could be better.
I think, and I want to elaborate on it for just a minute, because what I love about this podcast is you and I get to sit here and really show people who we are and how we feel and how I felt about I'm just on one today.
Yeah, you are.
How I felt about the orthodontic, curriculum with where we went to dental school was just that everything was focused on their curriculum, and we had the opportunity to learn and really take on that information, but at the end of the day, the hands-on experience, it was focused for the residents and it wasn't focused for us. So I 100% agree with you that coming out of dental school, I was not motivated to do any of those cases. I really didn't see the value in it because I didn't have the hands-on experience of it.
Well, yeah, because it all seemed, I worked for, the doctor that I worked for a couple of years before I moved out to Colorado. We did 15, she was a general practitioner as well, but we did 15 aligner cases a month.
Yeah.
We were doing I knew how to talk about aligners, I knew what to look for aligners, I knew how to scan, I knew all those things, but to me I was yeah, but do I want to there's so many things you want to learn when you're leaving school.
Yep.
Aligners to me, it really was looking at the minimally invasive way of approaching dentistry, and then when I went through COIS training, I really wanted to go through more aligner training, and then just really trying to kind of figure out what kind of practitioner do I want to be, and that to me aligned with, no pun intended, doing dentistry in a way that I'm setting people's TMD, bite, all these relationships up and identifying those problems early of early enamel loss, early detection of TMD issues, and creating a true outcome for that person where I can see their pathway in 10, 20, 30, 40 years from now, and knowing that I'm setting them up for a better healthy occlusion or bite for those who don't know what occlusion is. And that to me is so rewarding that I love clear aligners now, and I cannot get enough webinars that I attend or courses. I'm literally going to a course this weekend. I've been to so many, I've done so many classes at this point. Yeah.
I want to focus on because there are different companies out there and they all pretty much, do the same thing, if you are requesting, the same thing, right? So it comes from the provider. And I always tell patients that, I am the quarterback for your treatment. Whether you choose me or you go to an orthodontist or you're using ClearCorrect or you're using Invisalign or, RIP Smile Direct, whatever.
Yeah. Oh, that went out of business. Right?
Yeah, whatever. But
if we can just make one note that any kind of consumer direct product that's going to be a medical device really should be questioned before you do it.
No, absolutely. Let's
preface I saw a lot of nightmares coming out of that.
But it's making the patient feel valued in the sense of and safe, right? Because moving teeth is a scary thing, and for a lot of people, they want to ensure that they have someone in their corner. There is, you are changing their bite, the way that they're going to feel every day and the way that their teeth are going to look. So making sure that as a provider, you're answering all of their questions, allowing them to feel comfortable and let them know what your goals are from the beginning with this treatment. what are you looking to do, and how does that align with what they want?
Exactly.
Align.
See, look how good we are.
We're doing great today.
I think a big part of that, of what you just said, was what are the goals here, and what are the realistic expectations for what we can do with these aligners. Like,
Agreed.
There's a lot we can do, and I've used 2 different companies now, and I'm very excited to use the current company that I'm working with because I am seeing a little bit of a different result because I'm able to customize things a little bit more on my end. So I feel like some companies you're almost like relying on the technician behind the scenes to read your information, be like, hey, I want this, and this done. I want this outcome. I want you to change this, and then they're like designing that on the back end. I feel like with some clear aligner companies, like I'm physically able to go in there, move a tooth, add an attachment, move a tooth, add an attachment, like do these very minute changes that are going to make a difference, even if it's like me spending a little bit more time designing that case. I feel like having the control of that, just at this point, after doing dozens of cases at this point, like moving on to that next level for me, it's very exciting to be like, hey, I know this is the predictability of that. I know what the statistics are of this movement. I know where the reality of where this can take us.
And I think it's really important, as a provider that there are a few things that I want to touch on in today's episode, but, it's important to feel comfortable in what you're doing and how to safely move teeth and what's predictable, right? And like you said, having the autonomy to be like, I really love 80% of what, the technician or, this company has set up for me, whoever is doing that behind the scenes for you. But I want to tweak this individual tooth. Like, I know for me, I had a case this week that was ready for me to, review, and I actually went in and I intruded the tooth, to, whatever. I intruded the tooth because it was red and I wanted green contact only. So I didn't want them hitting weird or abnormal in that area, a very unprofessional description of that. But, they would feel that at the end. And so it's taking the time and to feel comfortable recognizing that in the beginning and understanding the platform. So I want to focus, on, do you really fully understand the platform that you're using and what resource does that company have, for you to learn and grow with them, right?
Yeah, and I would say, a lot more of these, I would say there's like 2 leaders in this field, and I would say both of them do offer free courses, they offer webinars, they offer TPO is one, and then TPS, which means like you have an orthodontist on the background that is you're able to ask questions with, and which is awesome. So I feel like all those resources, but I think some take it a step further when it comes to like, hey, I feel like a lot of this has to do with like my rep, like my local rep for my company that I'm working with. They send me webinars all the time that are free. They're like, hey, this course this weekend is, X amount of dollars, but if you go to it, then we'll refund you this, blah, blah, blah. Like, they're literally like, they want you to succeed in these and they want you to do more cases because they're a company and they want to have their product sold. So the fact that they are setting you up for success, but then you have like people that that are already doing it, you're bouncing ideas off of, practitioners that are more experienced than you are. And I think the more and more you do this, the more you realize like, hey, this is, in a lot of ways, more like simple. It's a simple thing to get started on doing. Yeah. But then there's a point where you need to know like, these are my limits at this point, and this is what I feel comfortable doing, and then slowly building on that. Yeah.
And there's, specific verbiage that I share with patients whenever I'm, expressing, the need for clear aligners and whether or not their case would be predictable or something that I could do. And I will share all of those with everybody. At some point in the future, we have big things coming up that we'll talk about soon. Yeah. But, along with that, it's having those conversations and realizing that when you are, investing in this company or in the CE, that you are going to feel good in what you're doing. Mm-hmm. I know for me, like, when you're coming out of dental school, if you would have told me, are you using TPS? I would have been like, what are you talking about? Right. So it's understanding that you have those resources. There is somebody, behind the scenes that can help you and help make sure things are predictable, but also, are they in alignment with what you want? And that brings me to my next point of like treatment preferences. What are your preferences?
Yep.
You know, are you setting them from the beginning, or are you just leaving them standard and then hoping that the case is going to turn out okay?
Yeah.
So what has your experience been like with treatment preferences on these platforms?
So I feel like, yeah, they both, I mean, both the companies I've worked with, you can set your preferences. I also have learned a lot more about how I'm initially submitting my cases, like my verbiage on what I'm saying when I'm submitting my first, kind of like submitting to the cloud for them to look at things and like to build that program from start to finish for me is it's very different than it was a year ago.
Yeah.
Like, because I know where, like, if I'm deprogramming a patient, if I'm doing these things, if I'm just like truly trying to like correct their bite or do this, and this is like millimeters of difference. This isn't like, you know, we're taking a tooth like 5 millimeters in some weird direction. These are like microscopic movements, but they make a huge change in someone's end result. And I feel like the preferences are, you have to set them. You have to set them, and you have to be very specific of what you want. But sometimes even I'll do that, like I'll put all that stuff in there and I'll see what that turns out for that patient. And I love that we have like computers now that we can literally sit there and like play with these things and like literally take your patient and put them on the computer screen.
Right.
You know what I mean? And plan those things without them even having to like spend extra time in your chair.
I think it's really beneficial, and one of the things, you know, because I utilize both of these, you know, companies that you're talking about, I do use both, and with the one you can actually integrate a CBCT into.
I just started doing that so much more early.
And so, you know, it's being able to realize that, hey, if I bodily move this tooth, you know, where is it going? Is there bone to support that?
Yeah.
So that's really exciting. The technology that we have is great, and I think when you're relaying that to their patients, they need to understand that you do have this experience and you do feel comfortable with it, and that yes, you're not an orthodontist, but hey, from the cases that you know I have completed, there's been a lot of success with tooth movements like yours, or that the movements that you need. But along with that, it comes with knowing when to say no.
Yeah.
Like, I'm not saying no to everybody. This isn't me telling everybody that clear aligners are for everyone and that you will make a bunch of money and that you should do them.
Oh, no.
This is not what this is. This is knowing that each individual case is different. Mm-hmm. And some of them, it's not going to be predictable, and maybe the patient will be compliant and it's not going to be a good outcome for them.
Well, patient selection is a huge part of it too.
Yeah.
Like, I had a patient, it was interesting because it was just this past week. He came in, my first time meeting him, but he had been a patient at my practice for a long time, younger guy. And, you know, we talked to him. He had probably more of an extreme form of crowding and things like that.
Yeah.
And some other issues going on. And I said, hey, like, I really think, like, now he's, like, chipping his anterior teeth. He's fracturing all these things. Like, his bite is really, like, that's exactly where those movements are coming from, is where his teeth are aligned to in that malocclusion. And I said, hey, like, is this, like, a concern of yours? He's like, yeah,
right.
like, you know, this is, you know, kind of, yeah, I get it, you know. And he's like, yeah, you know, like, I had braces when I was I didn't want braces, that's what it was. He's like, we didn't want like, traditional braces when I was a teenager. There's a huge, I would say, audience or patient population that doesn't like metal in their mouth,
right.
Or they have allergies and things like that, which is a huge population that what I deal with as a holistic dentist is figuring out solutions for patients who have allergies and, like, you know, more sensitivities to things and more autoimmune issues. So he did try clear aligners because, like, I didn't wear them.
Right.
Like, and when a patient's literally telling me, like...
But I love the honesty.
Yeah, he's like, I couldn't do it.
Yeah.
And I said, okay, well, thank you. You know, like,
right.
That's great. Like, I still want to bring up that these things are happening to your mouth, and
right.
This is going to be, like, an ongoing thing. You're only, like, 20-something, and...
Yep.
But, you know, there's also realizing that even though there is a better outcome for that person, that might not be what they want to do.
Yeah.
Yeah.
And I feel like it's listening to them and listening to, you know, what their wants are, but also, like, what their limitations are. Mm-hmm. Because you never want to put yourself in a position, you know, and I have a few cases of patients who, you know, I tell them, like, I'm going to see you back in 6 weeks. I'm giving you 6 trays. I don't hear from them for 3 months. Like, they cancel their appointment, and I'm like, what tray are you on? Like, have you been wearing the trays? And when they come back in, it's tray 17 on the top and 12 on the bottom. And I'm like, okay, so now we're doing a revision.
Mm-hmm.
And it's making sure that you're setting yourself up for not no stress, but like as less stress. You know, we already have so much stress as providers. And when you're thinking about taking on those cases, it's setting those expectations from the beginning, because you don't want a bunch of cases of patients who aren't going to follow the plan.
Yep.
And so I love that patient was honest with you.
Oh my gosh, I wish every patient was like, you know, like word vomited what they really thought. Which, I mean, I feel like at the end of the day, like we do a good job at like, you know, motivational interviewing, getting what a patient actually wants, and like there's nuance and like time that we take to find those answers. But, you know, when a patient clearly tells you like, I don't care.
You're like, okay. Well,
and that's fine. Maybe like in 4 years from now or 5 years from now, when he's a little older and more mature, then maybe he'll be like, hey, you know, that conversation we had, I think, you know, and that's great. That's just giving that person their options. And I think, you know, like the associate that I work with at my office, and then we have the owner who doesn't do clear aligners, but the other doctor that I work with does do clear aligners, but not very many cases.
Mm-hmm.
And I have found that the more conversations I have with patients, they're like, oh, I didn't know you guys even had this. I didn't know you guys even offered this. And that, to me, is like a huge thing of like, oh my gosh, like there's such an untouched population of people that, or I'll see someone that comes in that's like, they have aligners and I'm like, oh, who's doing your ortho? And they're like, oh, Dr. So-and-so. And it's not even an orthodontist, it's just another GP that's, you know, was doing them when they were starting it. So I think just somehow like allowing your hygiene team, your assisting team, like whatever that may be, to like allow your patients to know that is something that you are offering. And being very honest with patients, like, hey, like I think your case may be better suited for an orthodontist, and you have a good relationship with the orthodontist that you refer to, you know who they are, they know who you are, like, you know, those interpersonal or interprofessional things are so important, because they should know that you want to build that, because you're also still referring to them, you know what I mean? Yeah,
and that brings up a couple of points for me. Number one being that, you know, for me, I think that once I have knowledge on something, that's going to be the way I operate. Like, if I learn something and I know that's the standard of care, I'm going to offer it to you, because it's my job as a clinician to let you know I'm seeing these signs, and this is how I can help you. Whether or not you're ready for it today or in 2 years, I want you to know that, like, I have a commitment to my field and to my patients that I'm going to offer it to you. I'm not saying you have to start today, but I see this, and at some point we need to have the conversation, whether you're ready or not. And I think that goes into, you know, along with that, having the marketing in place as well. Because if you're having a busy day and maybe you're just coming in, you're doing the check, and you're not bringing it up, even though the signs are there, and maybe your team didn't bring it up that day, they need to see, like, you know, a pamphlet or a flyer or, you know, some sort of marketing that says, like, this is an option for you. Have you ever thought about the way that your teeth fit together? Or do you have a lot of wear on your teeth, and what does that look like for you? So I think it's really important to make sure that, you know, if you're investing the time in learning about clear aligners and want to integrate that into your practice, it's being consistent and saying, you know, even if, you know, you're looking back on the notes and the previous dentist has offered it in the past, you know, the associates already maybe discussed it, saying, hey, I know this was brought up to you, I'm seeing the same things, how are you feeling about that, and where are you at with it? So,
well, a lot of that has to do with, like, continued documentation. Like, how are you documenting patients' changes in their bite? How are you documenting changes in, like, anterior wear and fracturing? How are you documenting their TMD assessments? All these things. Everything that we look at, not only am I doing these things on every single patient consistently, like I'm checking their TMD and oral cancer screen. Like, it's almost like you get this rhythm of everything you do on every patient, no matter who it is.
Right.
If it's a 5-year-old or a 95-year-old, I'm checking all of those things. And then obviously I'm, you know, picking out certain things that I'm doing more often on other patients.
Right.
Like, you know, obviously like a 5-year-old, I'm discussing different things. But documenting those things physically in their chart, like, you know, having your hygienist or assistant, they're taking notes, but also, like, are you scanning your patients? So then you're actually tracking, like, what is changing?
Right.
Like, yeah, photos, I think intraoral photos were, like, my bread and butter for, like, a decade. But now that I have a scanner that's literally designated to my hygiene team, and they're all motivated to use it, and we've gone through training, and they want to use it, and they want to do these things, and they want to talk about this stuff.
Right.
like, I think intraoral photos have their place, and I think they're awesome. They're great for documentation. They're great for when I'm doing a prep and I'm
Right.
trying to say, like, oh, this is a crack, this is a fracture, I'm submitting this stuff to your insurance. But when it comes to being like, oh, are you losing more of your tooth structure? Like,
Nobody's ever.
how do you know that?
Right. Nobody's ever told me this before,
Yeah.
or I've never seen this, or this wasn't a problem the last time I was in.
Yeah.
But the thing is like you said, we have the tools. There's no reason that for every new patient they shouldn't be getting a baseline scan, whether that's iTero, whether that's Trios. They should be getting a scan. It's going to have the heat map. It's going to tell you how their teeth are hitting. 1 year later, you circle back and you have it in the chart. Here's another scan. Hey, look, you have had X, Y, and Z. For a year now, this is how it's progressed. This is how much attrition, I don't think a lot of people are doing that.
Mhm.
And, I find that sometimes, it's like, for me, we get into our routine of things and it's like, take the 5 minutes and take the scan.
Well, it's taking the 5 minutes, but also like finding, because there's a trade-off. There's a trade-off, and then we just had this meeting with my hygiene team this week. It was like, hey, we really, like, we're doing it on all new patients, but then we're like slowly integrating it with like existing patients. Because you really have like, there's certain patients that you really truly like, they're in there for an hour with the hygienist because they talk a little bit more, they have a little more of a complex medical history. Like, whenever they're in there, there's a little more going on with them.
Yeah.
And those patients, obviously, we might wait till like they're not due for x-rays to do the scan or whatever it may be. Or, hey, we're not going to update all of their intraoral photos that day. We're going to take a scan today instead. And the nice thing about like the newer technology that we get, and the more updated in this technology, is things are so much faster.
Yeah.
Like me taking literally a 3-second iTero scan.
Right.
Like 3 minutes, whatever.
3 minutes.
My hygienists are more excited to do that because they also get the reaction from their patients like, oh my gosh, like when people are excited to see something, that makes us excited to be there and to do our job because it's getting that interaction. You're not just like talking at someone. Like, I don't like talking at my patients. I like talking with them and looking at something and being like, hey, like, what do you see here? Like, do you see these chips on your front teeth? Does that ever bother you? Have you ever talked about that before? And I think patients, I've had patients start clear aligners with me that literally, like, they're in their, like, 70s.
Oh, yeah.
You know what I mean? Like, it's patients that you can't sit there and be like, hey, I'm not going to offer this to a patient because of their age.
Mm-hmm.
I'm not going to offer this to this patient because of, I think they're this way personality-wise.
Yeah.
And that's fine. And that person, is like, hey, like, most of the time they're just like, they're appreciative of the information because of how I'm saying it to them. I'm not being like, you need, bringing them down. It's creating more of a dialogue than it is, treatment planning something and then walking out of the room.
Right, talking with them, not talking at them, letting them know what you're finding and that you're there for them. I always tell patients, I'm here for you when you're ready.
Yeah.
Like, when you're
If
ready.
you have questions, let's come in for like a free, just a treatment conference. Like, let's just chat for like 30 minutes.
Yeah.
That's fine,
And I think that goes a long way in any aspect of dentistry, but especially in clear aligners, for sure. But yeah, I really hope this has motivated and helped people understand a little bit more about clear aligners and how we're integrating it into practice. I think some of the key takeaways would be, having a good relationship with your local rep.
Yep.
Starting there, feeling comfortable with jumping into that company, utilizing the resources, whether it's local CE or free videos on their website, feeling comfortable with that landing page of, hey, you can move these teeth, add buttons here, and then also along with that, just having a standard of care, making sure that you're offering these to patients, utilizing your scanner and the technology that you have in the office. I'm really passionate about clear aligners. If anyone has any questions, please feel free to reach out to Marsha and I.
Yep, we're here for you. So that leads us to our next episode, and I think we're going to talk about minimally invasive dentistry.
That sounds great.
Yeah.